A very good day to all of you. Thank you for tuning in and listening in to this topic entitled Feedback to Trainees. I'm Dr. Shanggar. When I was given this topic, the first thoughts were, number one, this is not our usual run-of-the-mill topic. Number two, it is a topic that I need to look up and anticipate that I may have a lot of bad habits too in giving feedback to students. Therefore, my presentation today is to share what I found out around this topic, and together we improve ourselves. Any thoughts and ideas you have, feel free to discuss with us when we meet physically during the physical workshop. First, let me start with this important question. What is feedback? Looking at the dictionary, feedback is actually the information about reactions to a product, a person's performance of a task, etc. This can be used as a basis for improvement. We always confuse this with assessment. So what is assessment then? Assessment is defined as a process of judging or deciding the amount, value, quality, or importance of something. It can be formative assessment like your usual workplace based assessment, or a summative assessment where, like the exams, the candidates which have to go through and is marked, and a decision is made whether he or she passes or fails. Whereas in feedback, it is giving info to the candidate on how someone is doing towards achieving personal goal, which in our case is usually to become a well-trained surgeon and also capable of conducting proper research activities. What it is not is how sometimes we give feedback like, wow, your logbook don't have enough thyroidectomy cases. Next time, complete your required numbers, otherwise you will fail. Then in the feedback form, we write, not enough thyroidectomy, have to do more. In our Masters in Surgery program, we have several types of feedback. The first type, I would classify it as the low-level feedback. This is some of the feedbacks that you would give to the trainee in an informal setting and ad hoc basis. For example, during rounds, if the positive family history is not mentioned at all for a prostate cancer, for example, you would feedback that this is a weakness. The candidate needs to concentrate more on that part of the history. But you might have also come across trainers that say, is this how you present? My son presents better than you. Get out and come back only when you can present better. This is actually not a feedback. You have actually assessed the trainee and given an impression and has ordered him or her to repeat the so-called test of history presentation if you want. Another example is maybe in the OT, where the trainee could be informed that their explanation and complication of the surgery is inadequate. Or maybe if you notice that the candidate is stripping the ureter bare when mobilizing with finger, you can stop them and feedback to them. The immediate remedy will be to demonstrate again how it is done properly, and then can look for improvement the next time. The next classification of level of feedback is the mid-level. So this can be delivered in a formal way to the trainees as part of a formative assessment tool. For example, when they finish one posting and undergo end of posting assessment, or in the future, our curriculum might introduce workplace-based assessment like direct observation of procedures, DOBS, or case-based discussion, etc. As a trainer assessing their performance, you will be required to give your feedback on their knowledge, skills, the involvement while in posting, and so on. In your feedback, it is best that you suggest what needs improvement. Why? Because these feedbacks from the assessment tools that were used will supposedly be used by trainees for learning and improvement in their future performance. At present, in our program, what we have at the end of each posting is when one of us will be required to assess the trainee based on all these assessment points and give them a feedback, as shown in this form that you might have come across. This may include some strengths of the candidate, some general comments, and some recommendation whether the candidate can progress to the next posting or not. And finally, we would just sign off as the supervisor who did this assessment and feedback. It is very important on our part that we give real quality feedback to the candidates. Let me give you some reasons and examples on why these feedbacks are important. Number one, it contributes to the evaluation of the trainee. A consistent feedback is very important so that we can justify in case we ask someone to repeat a posting or, for example, fail a candidate. We need excellent documentation of consistent poor performance and repeated feedback that has been given, which is definitely essential, especially in this day and age. Number two, it will give the candidate some idea after discussion on how to improve their performance. If you tell them during the feedback session that they could probably go to OT on a certain day and that chances will be given to do certain part of the operation if you find the logbook is poor, then this will also influence the trainee's performance and he or she will be motivated to actually improve themselves. The third level of feedback is what I call the high level one. This is during a summative assessment where the decision on whether the trainee can progress will be made. It is more formal with periodic sessions, which in our case takes place every 6 months. You all may have already been part of this process, I'm sure. We have the research and also the clinical assessment where all the formative assessments that has taken place are evaluated and the feedback is given to the candidate. It is basically when the trainee can also reflect on where he or she stands in terms of their performance. Feedback will give them an idea on where they have been weak, what they have done well, what could have been better, etc. This is where, as trainers, we have to also reflect on ourselves whether we have given quality feedback for the candidates to be able to achieve their final goal, which is to become surgeons. These are the forms that we use in our department for research on the left and for clinical assessment on the right, and finally to give them feedback to take away. Hope all of you have come across these forms. A good feedback with constructive criticism with ways to overcome deficiencies from a trainer definitely will motivate the trainee to excel further in his or her career. You must remember, our trainees, most of them have chosen to become specialists because of their ultimate goal to become excellent surgeons. None of them would like to drop out halfway, and therefore they are all eager to hear from you and on ways to improve. Therefore, we must give them good quality feedback in order to facilitate this. So what feedback should not be is to give false impression to the candidate about his overall performance, his or her overall performance. This will encourage the continuation of the same behavior, for example. So why have you been chosen to give feedback, to become supervisors, for example? You may think that you are not senior enough, or you are actually hospital staff. Why should I be involved in giving feedback or assessment for a candidate? Actually, you are all trainers and supervisors. You see and you interact with the trainees on a daily basis. You do research with them. So you all definitely qualify to give your feedback. Remember, feedback can also come from peers and colleagues, and also from patients in a 360-degree format. So you will be the one who will take all this info into account and advise accordingly during the summative assessment and feedback provision. Now, I would like to go into some of the barriers that are commonly encountered in the delivery of the feedback. What we see in some of the trainers are that they are too kind, actually. They're very kind and always say very positive things about a candidate. This might create, as I said before, a false impression, about the ability of the trainee. Because one person may be giving positive feedback always with regards to one candidate, and another supervisor in another posting gives negative feedback for the same candidate. This may create inconsistency, as we believe the candidates should mostly be consistent in most postings. Next is when the feedback does not have enough details. For example, if the forms by the trainer says that the candidate is confident but he has to read more, This is a very general feedback with regards to the student's capability, and because it lacks details of a specific situation that the trainee showed confidence, and also lacks specific details of why he has to read more. Next, the next barrier that I would like to mention here is the timing of when the feedback is given, which is always a problem. When it is a 6 monthly formal feedback, then which is planned ahead, that is fine, that's okay. But if a feedback is given long after an event, then it loses its effectiveness. Like for example, if you encountered some form of incident in the OT that you want to mention to the candidate, and also give him some remedial measures, but you don't do it immediately, but you keep it till maybe 6 weeks later when you suddenly remembered, then it will not make much sense, because the memory is not there, you know. Who gives feedback is also important, depending on the level of the feedback session. If someone senior is allocated to give feedback for a particular session, and then suddenly for some reason he or she is replaced by a junior for a crucial assessment, which decides whether the candidate goes forward or not, and the senior supervisor is replaced, then that might look very unprofessional, and the students might feel that could he have done better with a senior supervisor. So we need to be very careful in allocation of trainers or supervisors for feedback purposes. It must also be clear that there should be no personal feud with the trainee whenever with a trainee in the training program during any feedback session. If you feel you are unable to be fair to a particular candidate, you must actually recuse yourself. Continuing on regarding the barriers to feedback, next is the physical barrier. This is with regards to where you give your feedback, the venue where you give your feedback to the candidates. If it is a scheduled 6 monthly one, then it is fine because the venue is decided. But if it is the one that happens in the ward or in the OT, so it might not be a suitable place to discuss the weakness of a candidate and all. So it must be in a proper place, which I will come again to it when I talk about some tips to do proper feedback. Next is the language. Although uncommon in our setting here, so it is also important that the discussion is clear and well understood by both parties. And please do not show any discrimination towards the ethnicity, nationality, if your candidate is a foreigner, or even towards the gender of the trainee. Now, taking all the potential barriers into consideration, let me try to give some tips on how to give quality feedback. I'm not saying that I'm an expert. As I said earlier, I even myself, when I went through this content for this presentation, noticed that we have some bad habits. Okay, so firstly, when you are going through the assessment or performance of the candidate, plan exactly what are the areas that you would like to highlight. And it must be individualized to each candidate. You cannot expect that one size will fit all. This is actually not an exam where you want to standardize the questions. That means you want to assess somebody at same level, then you would normally standardize the questions. But in this case, each individual candidate that comes to you for an assessment and require a feedback, they are unique on their own actually. Next is the timing. Okay, as I mentioned earlier, it is best to do immediately after the event as the memory is still fresh. Understand that in summative ones, where you give summative feedbacks, that is not possible, where you have to consolidate all the available documents from maybe workplace-based assessments or comments from some end of posting assessments. So you need to consolidate all that. But if you are doing some informal feedbacks, or when you are doing workplace assessment feedbacks, please do it as the event happens. Next is the venue. Where would you like to give the feedback to your trainees? Ideally, it should be one-to-one, okay, except where when there is a panel appointed, you might have a panel of two supervisors sitting and going through documents. But in that case, you can probably divide the job and give the candidate feedback based on what you have planned to do. Also, it should not be in front of others like fellow colleagues, patients, nurses, etc. So you at all costs you want to avoid a hostile environment, and you also don't want to put the candidate down in front of others. Some of the specific tips that you may want to consider to improve your quality of your feedback would be number one, maybe to think of a specific event or presentation or behavior of the candidate that needs addressing. Okay, it's sometimes quite impossible to give feedback on everything that the candidate does, or every assessment that you have done. So you may just want to plan and do something very specific, or address some specific behavior. It is also advisable that we don't judge a person. So you should not judge a person unless whatever the point of contention in that candidate's case is always repeating. Okay, so sometimes we hear from an impression from a previous posting. Somebody would have told you, oh, that candidate is actually quite poor. You just be careful of when they come to your posting and all that. So you should not. It's only human nature to actually to that you might get influenced by this, but by right you should not judge the candidate from a previous opinion. Always give your opinion on what is on the person that is in front of you, and you assess fresh. So feedback does not only mean you have to do feedback also does not mean that you have to give constructive criticism. That means you say, okay, you are not so good in this particular area, so you may need to improve and all that. So and how to improve. So that is constructive criticism. But you can always also give positive feedback, so that you can document the strength of the candidate, so that he can actually be motivated to do better. As part of the feedback, you could also give the trainee some ways to improve themselves, like helping with reading techniques. If knowledge is poor in a candidate, you can encourage to organize some form of learning session during the feedback session, and give them some idea how to do it, so that they can actually gain some improvement before coming for the next session in maybe 6 months time. Okay, so also avoid giving like a lecture to the candidate. So always try to have a two-way dialogue, back and forth, where everyone is at ease discussing the issue at hand. Do not just lecture and then, okay, done, you can go now, time's up. So it's not a right way to do, and the candidate might feel very demoralized actually. So you can also choose some models that are in the literature, that I came across a few models on how to give feedback. You might be doing it already, but let me give you some ideas from the next slide onwards on some models that I came across on how in the literature that they have described on methods of giving feedbacks. So the first is the feedback sandwich, they call it. This is where you give your critical views sandwiched between positive points. They say you shouldn't do it too often, as the candidates will be able to predict what you are going to say, as they will be waiting for you to say, but, so one of the example is, maybe I'll just read it from this slide. I'm very happy that you managed to cancel all the bookings in the OT list due to the COVID situation. But it is unfortunate that 2 patients turned up despite receiving the message of cancellation. Maybe we should look into your communication skill and identify how this message was missed. Anyway, this happens sometimes, but I was quite impressed that you actually had a staff ready for this eventuality to explain the situation to patient. So that means you started off with giving some positive vibes to the candidate, and then you criticized him for poor communication. Then you went on to give him some positive feedback again. So the next is the chronological fashion feedback. This is to go through the event in order as it happens, but this may not be a very good example to follow if the feedback session is going to be long. So one example is, maybe I just take in a urological example, when you notice when I notice that you actually, this is like having a feedback session with a student, and you say, I noticed that when you attended to the patient with AUR, you managed to explain to him the problem and the need for the CBD very well. After that, you actually failed to insert the catheter, and when that happened, you began to show distress to the patient. Maybe at that point you could have called for help or opinion, but when you tried again, actually urethral injury happened. But I must say, once you realize that there was a urethral injury and the patient's bladder was distended, you managed to quickly insert an SPC and relieve the patient. So that's how chronological fashion feedback may sound like. Next is the Pendleton model, and so this I will start off with an example. So it will be like a two-way dialogue. Yeah. So first you may say, okay, to the candidate, what do you think went well in the last 6 months? So the candidate will answer, I managed to do 3 lab colis with minimal supervision last 2 months. Also, my proposal was accepted for research. All the operations went well except the last one had some complications. So what do you think? So then you say, what do you think could be done differently? Candidate says, maybe I should have been more diligent when I was mobilizing the gallbladder. Could you have called your trainer earlier? Yeah, possibly. Then you say, what do you think could be further improved? Then the candidate might answer, I should know when to call for help, and also maybe I should handle the tissue better when I'm doing a dissection. Then you say, so how do you think this can be achieved? And the candidate, or in some cases the candidate may not know how to say that, but you can also suggest some help. So in this case, maybe you can say, I think maybe you should get more numbers, do more, and then you will improve. This will come with numbers. Okay, so this is a two-way communication, starting off in a positive way, asking what went well in the last 6 months, and then you give an opportunity to the candidate to reflect on the event and suggest improvement on his own. If it is not possible, even you can suggest improvement. The weakness can then be identified, and finally we can mutually agree on a plan to improve. So this brings me to my last slide, which is to summarize what I have said, so I'll just go through this summary slide. In giving a good quality feedback, we must facilitate and always be guided by self-reflection, either from the candidate's part or from our part. So we have to be specifically directed towards agreed learning goals, which is to become a good surgeon at the end. Okay, we have to be specific to a particular event, give relevant and descriptive. So describe your feedback well to the candidate, okay, and document it. You have to be non-judgmental and always focus, and also have some focus on the trainees' behavior, and lastly, always include an action plan for future learning goals. You must always have some plan on how to improve the situation. Thank you very much.